I'd like to introduce Chula Gunawadane. Chula, I'll do my brief intro, and then please feel free to kind of expand in the way that you'd like to. But so Chula is a BACP, BAPAM, and Black and African Therapy Network registered therapist, spending his former years as a musician. Started as a classically trained pianist and violinist, becoming a self-taught guitarist and drummer, and enjoyed a professional career in music during his 20s. After coming into recovery in 2003, Chula worked one-to-one and in a group with over 1,000 clients in community-based treatment as a drug and alcohol practitioner, before moving into treatment management and training at consultancy in 2010. Chula then qualified as a counselling psychotherapist in 2014, and alongside his private practice, he provides clinical consultancy, training and supervision to institutions such as Steps to Recovery, Music Support, Help Musicians, and the Centre for Social Justice. Chula writes and presents on various platforms, lectures on addiction at the MSc at London South Bank University, and drums for the Council of Neptune. Coming from a Buddhist family, Chula uses his philosophy to enhance both his personal and professional life. Chula, thank you so much. I'm going to hand over to you.
Thanks, Anushka, and thank you for inviting me here today. It's really an honour and a privilege, and thank you to our previous speakers, Adam and Cornetta. It was great. Can you hear me okay? Just checking. Great. It's really interesting, and this has been really well planned, actually. I don't know if you knew exactly what everyone was going to talk about, but I think I'm going to tie it together quite nicely by just really giving you my story. And as Adam and Cornetta were both speaking, I was listening to what they were saying, and almost all of it applies to me and my story and what's brought me here today. In terms of, being a musician, being an addict in recovery, and being a clinician and psychotherapist as well. And resilience is a real, we've already discovered the fluidity and the variety of different definitions. And one thing you said at the beginning, Anushka, was about nurturing and coping mechanisms, and that's really interesting because that's quite particular to me. So my story begins when I was 4 years old when my mother went blind, and this was something that affected her nurturing capability. So while she's an amazing, inspiring woman and brought up 3 children and taught piano to over 40 kids every week, and has got a master's and 2 degrees, and set up a charity which has over 400 members in it for blind people. The disability of not having her sight had a very pertinent and profound impact on her ability to parent adequately, and that I received that in a very particular way, in that my attachment was broken at that point, having had the eye contact with her and having had that sort of close contact with her, especially being the firstborn child. To have that suddenly severed for me was a real loss. And in terms of resilience, it would be fair to say that any natural resistance that I had as a young child was ripped away at that point. And a lot of these sort of maladapted coping mechanisms started to kick in order to carry me through the devastation that was causing, and also the distraction that caused, because she was in and out of hospital. My father had to change professions in order to manage the family. Relatives and friends were coming in, and there were 2 younger boys who needed care as well. So there was all this stuff going on, and Adam spoke about adverse childhood experiences, and Cornetta spoke about the systemic element. The system that I was in had this huge fracture in it, and that really impacted on my resilience, as I said, and that led me down a further or a darker path. When I was 9.5, I was sexually abused, and that left me even more broken than I had been by my mother losing her sight. And then to cope with that, I picked up cigarettes and alcohol. So at the age of 9.5, I think it was third year juniors in those days. They've all changed the system now, but I started smoking and drinking. And shortly after that, I discovered Metallica. So I think I was 12 when I discovered Metallica, much to my parents' dismay, especially my mother's. But for me, the rage, the anger that I heard, the aggression that I heard coming out of the speakers connected with the inner rage that I had. And actually, it was what gave me resilience. That connection that I found in the music, along with the smoking and drinking, which was self-medicating and self-regulating the trauma and the associated feelings, in some ways helped me not to completely dissociate, as Adam was talking about. And I was able to remain present in the chaos, but I unfortunately added a fair amount of chaos to that. And the interesting thing about that particular style of music and the whole heavy metal scene was, in addition to what I've mentioned in terms of ACEs, I also had been to a school where I was one of, I think, 3 non-white people in the whole class. And it was a school in Mill Hill, which was next to a barracks. So there were loads of army kids who were in the school as well. And it was quite a rough and mixed school in terms of what was going on, different abilities. But I definitely felt like I didn't fit in. And then I found this group of people where I was completely accepted. I didn't feel comfortable at home. I didn't feel like my relatives and my parents and the Sri Lankan culture that I'd been born into, and even the Buddhism at that time didn't make any sense to me. So I was rebelling against all of that. I was reeling from the attachment issues with my mother losing her sight. And then in conjunction to that, I'd suddenly found this place where my skills as a musician, or my experience as a musician, was tying into something that was soothing all the pain that I was carrying. And I remember in my teens, starting to play guitar in bands, and I was still playing in orchestras and still doing my piano and doing all my grades and that stuff, but playing in bands and playing guitar and all the things that came along with that. And of course, there was more drugs, and then girls came into the picture. I just found myself in this kind of almost a fantasy land, like school, academics, all of that stuff got pushed to one side. And I developed this real passion for being a musician and wanting to be a musician. And that's all I dreamt of doing. I wanted to be in a band, and I didn't want to be rich or famous. I just wanted to be in a band that could provide for me what Metallica, provide for somebody what Metallica provided for me. I wanted to be able to reach someone in pain through what I was doing. And that's what it was always about for me. And I went on, and I went away to music college in Manchester, actually, at University College Salford. And I went in there on the strength of my piano and violin. But unfortunately, I wanted to play guitar. I didn't want to do classical music anymore. I was kind of really into the other stuff. And then my guitar, I was self-taught, so I wasn't quite up to scratch. So they gave me a year to try, but I just couldn't handle all the scales and the multiples of chords that you had to learn. I did the pieces fine, but then I was taking a lot of drugs, I was partying a lot, and ended up having to come back to London from there after a year without any qualifications at all. And then I switched to the drums because a friend of mine was in a band, needed a drummer, and he said, look, will you just come down and hold a beat? So I did that. So I started playing drums in this band, and this time, I'd forged my identity as a musician. As we were talking about earlier, it was really important to me. That's who I was, and nothing else matters, to coin a phrase. And I really just wanted to get signed, and that's what I worked towards. And I was really fortunate, we worked really hard, and the band started to gather a following. And we were playing all the sort of circuit in Camden and a bit further afield. And then we were lucky enough to get a record deal when I was about 21. And it was the 90s, and there was Kurt Cobain, and there was a lot of stuff going on in terms of what was termed heroin chic at the time. And I would say that even at that time, although I was comfortable with who I was and what I was doing, I wouldn't say that I was a particularly resilient individual. I would say I was quite a fragile individual, but I had developed this sort of hard shell that protected my inner wounds and the trauma that I'd experienced in my early life. And the drugs and alcohol that were there were a coping mechanism, but at that point weren't really causing a problem, even though I was doing them fairly addictively and on a daily basis. And then unfortunately I made the decision to try heroin, and then got into that and became addicted after a very short time. And again, you know, just looking at all of that, I see addiction as a maladaptive coping mechanism. I think that addiction is generally a way of coping with intolerable feelings that are associated with trauma of some kind. And that's what it was for me. And it enabled me to be resilient on the surface, and to leave this life that I was leaving, to take this record deal, and to start, you know, do some more serious touring and recording. Unfortunately for me, the heroin, you know, eclipsed that and overtook everything. It became the priority in my life. And I've always said that, you know, I began a musician who dabbled in drugs, and I ended up a drug addict who dabbled in music. And the music became less important. And, you know, talking of the systems at the time, I don't know for sure if the record company or the management knew that I was a heroin addict, but they definitely knew that I was messy, and they definitely knew there were problems. But not at any one time did anyone reach out or try to help or say, are you okay? You know, it was all about, okay, well, you need to do the next gig, you need to write the next song, you need to do the next thing, the next thing, the next thing. Let's keep you on the treadmill. Let's try and get some of this money back. And there wasn't really any mental health support. I mean, it just wasn't really talked about in those days. And it's great that we're talking about it so much now. But at the time, there was nothing there, you know, with regards to that kind of support. So it just wasn't thought about, you know, and nobody said anything to me. And again, I'm not blaming the industry, because I'm aware of all the systemic factors from my childhood that created the trauma that led to the addictive coping mechanism that led to where I found myself. But I do think that that's a place where we can change things now. I think if we change the system, and I've got a business called Attune, where we go in and we build support packages for bands on tour, and we look at that holistically. We bring in personal trainers, nutritionists, psychotherapists, coaches, sober companions, you know, whatever the band needs, we can bring in a support package that enables them to continue doing their work in a healthy way. That wasn't there for me. And unfortunately, what happened was my addiction took over. I became very dysfunctional and destructive, not just self-destructive, but other destructive, environmentally destructive to what was around me. And then unfortunately, we got dropped and the band was no more. So I found myself, you know, around 26, 27 with no qualifications. You know, my dreams that had been coming true were suddenly shattered. Everything was gone. And all I had was this dependency on heroin. And by that time, methadone as well. And I was smoking cannabis on a daily basis from morning till night. And I just didn't have any stability whatsoever. I was still living at home in my childhood bedroom. And I was stealing from my parents. I was stealing from the family home. I was stealing, you know, shoplifting, doing all the things that drug addicts end up doing, unfortunately. And those last few years of my using, I really went downhill quite dramatically, went down to 6.5 stone. And music became something so distant from me at that point that I'd become a shell of my former self. Luckily for me, I started to see a counsellor really to keep my mum happy. She was paying for it, and just to keep her off my back. I started seeing a chap who had an addiction specialism. He was a psychodynamic psychotherapist, but he knew about addiction, and he slowly started drip feeding me all this stuff around 12-step programs, Narcotics Anonymous, treatment, rehabilitation, you know, and very, very gently led me towards coming up with a bright idea, or I thought I did, that I needed to go to rehab. What I didn't realize was that he had planted the seed and was slowly watering it over a couple of years. But it came to me in February 2003 that I had to go to rehab, that I'd been trying to stop using heroin, but I just couldn't. And I realized that I had to go somewhere and actually get proper treatment. And again, this is something that I do in my work a lot. I do assessments for music support, and I work with BAPAM clients and HMUK clients. And sometimes there's a point where I have to say to my clients, look, you know, we've tried it your way. You've tried to stop. You tried to stop drinking, or you tried to stop using drugs, and they're saying, I can't stop touring, or I can't stop making music. And what about my career? And I'm sitting there saying, well, your addiction is destroying your career. And enough's enough. We've tried it your way. It hasn't worked. I think you need to go into treatment. And there's been quite a few people who I've worked with who have finally listened to that and gone the same route as me, gone into 12-step residential treatment and come out the other side, used the 12-step programs to become part of fellowship. And again, when we talk about resilience and a systemic approach to that, or a systemic perspective, my experience is that whilst rehab got me clean, whilst I have a very loving family and friends that supported me, and whilst I have, I had some talent in music and I had something that I could get back into, what really, really helped me at this point to gain some actual resilience with life and with coping with difficult feelings and the trauma of the past was this 12-step program. And it taught me how to live life on life's terms in a way that I'd never really learned as a child or in my developmental years. And alongside that, I went back into psychotherapy, and I've been in and out of therapy for the last 20 years. And I then started working in the drug and alcohol field. So at that point, I had a decision to make. Like, I knew I was a musician through and through, and I would have loved to go back and get another record deal. But I was 30, and I kind of accepted the fact that maybe I was a bit too old for that, in the way that I had experienced it before. And so I decided to keep music as a hobby, and I ventured into the drug and alcohol field as a practitioner. And then through all of that, through that process, it brought me to being a psychotherapist, and then getting involved with the music charities, and it feels like it's come full circle for me. I'm working with lots of musicians and CEOs and record companies, high profile musicians, tour managers. We were talking about a space for people to explore their truth and to bring diversity out into discussion. We've done a lot of work around providing support groups for companies or for bands and their entourage, and just creating a room where people can come in and speak their truth and be heard, I think is an incredibly valuable tool. And it's led to people then discovering that they needed to do a bit of work around this, or a bit of work around that, or change this or change that. And through that, we've found where people perhaps didn't have resilience, but they didn't really realize that they didn't have resilience. And then we've been able to guide them towards finding the things that bring that natural resilience or the development of it in. And for me, that's bolstered my own. So, through my work, through connecting again with the music industry in this way, and I've kept playing. So I still have a band. It's just fun. But there was a point where I played in a recovery band called the Should Be Deads, and everyone was in recovery, and we played at the NA World Convention in Barcelona in a huge Roman amphitheater. We went to the Dead Sea and played at the European convention, and there was a real connection with us, and we were doing it because we were passionate about music. There was no money involved for us. There was no chance of a record deal involved for any of us. It was purely about being in recovery, having this second chance at life, and the joy of music and the passion of music coming together. And that really, for me, built a lot of resilience in terms of, I've had to work on the loss and the bereavement of my career, is what I wanted to do for many, many years. And it has been a loss for me. But I've worked on that, and I've worked through it, and I'm at peace with it now. And I love playing, and I can't really, I wouldn't want to be without it. And I think for me, the important thing to remember when we're working with people in the music industry, wherever that may be, artists, managers, crew, or people in the other sides of the industry, is that, like we were saying earlier, people have so many facets to them that we have to work from a holistic perspective and look at the system, look at where they've come from, look at what they're in. And I work very psychodynamically. I don't jump straight back to the Oedipal complex or mum and dad and ask people how they feel about their mother on the first session. But definitely there is something to be said for that kind of work. For all of us, I think, to understand who we are in the here and now, we need to understand where we came from. And in order to be resilient in the here and now, we need to understand where perhaps that resilience was fractured or was challenged or had to adapt in order to survive whatever it is we've been through. So I think I'm going to end it there. I hope that somebody somewhere has got something out of that. And it's been a pleasure and a privilege to be here. Thank you very much again. Thank you for listening.
Chula, thank you so much for gifting us the privilege to be present and listening to your story. And I think this is a CPD event, so we're here as kind of professionals to continue our learning and development. But I think this humanness, the kind of openness, it helps to bring that kind of message that, yeah, of course, we are multifaceted, we are professionals, we are so many things, and we all have stories as well of journeys where we've had to be resilient, where that has been fluid. And I think that was really, for me, definitely really special to be kind of part of that. So thank you.
Thank you. If anyone has any questions at all, I'm happy to answer them. I'm an open book, and personal or professional.
I have a question.
Go for it.
Hey, and thank you, Chula, for your amazing story. I was very touched and inspired by that. I'm a musician, music teacher, freelance musician. I used to have an originals band when I was a teenager, and it fizzled out. Not quite as deep into a record deal as you were in your story, but I then found my music journey going towards studying music, and I was at Salford Uni as well. I went through it, thankfully, and then I was a psychosis patient, and I ended up with a bipolar disorder diagnosis. And my dreams of being a professional original musician in my mind at that time were shattered, just because of the psychosocial dysfunctionalities and all the various resulting situations I ended up in, making me feel like that was impossible. So I went into teaching. During the pandemic, I did more teaching because it was all that we could do. We couldn't do cover gigs and stuff like that. And I got into something called music nurture group practitioning. You may have heard of it. It's a blend of trauma reduction therapies and light touch music therapy and light touch music education for SMEH and SEND children. The results have been amazing. I did a government pilot earlier this year for the DV on that, and I'm currently trying to optimize it for all the children in secondary schools, and perhaps also further and higher education students, and perhaps also adults. I would be really interested in speaking to you about perhaps some ideas that I were inspired by hearing in your story that might help me optimize this for teenagers and people in their 20s and 30s. It's something that I seem to be struggling with a little bit, just because the pilot was for a year with primary school children, and any suggestions that you might have for making something like that even more crucial for even more people who may not even know the love evoking properties of music in general. That's all. But yeah, just thank you for your story. It was amazing, very inspiring, and appreciate you listening. Thank you.
Thank you. I mean, that's a long answer to a complex question. So it sounds amazing, and I'd really like to hear more about it. So please contact me, and we'll book in a Zoom and have a chat about it all. I think the healing power of music. I mean, personally, I think my experience of music as a teenager kept me alive. If I hadn't had that, I don't know what would have happened to me. I really don't. And I think that's the same for many of us. You know, music gives us healing and love and light on so many levels at so many different times of life. And I think that, you know, what you're doing, that's just so valuable. I mean, it's amazing. So it's inspiring just to hear you say it. But please make contact, and we'll talk more about that.
Thank you very much.
Can I say something quickly?
Please do.
Hi, we've met before at Music Support quite a while ago.
Yes,
yes, it's nice to see you.
Nice to see you.
Thank you so much for that. It was so powerful, and I'm very moved, and just want to say how powerful it is to hear your story. And I really, you know, we weren't supposed to know about therapists before, but I think there's such a, I feel more connected when I feel a sense of who I'm working with as a client, actually. And there's this, you know, and talking about it, and you being a public speaker, there's real power in your story, and it gives more validity to what you do, because you're doing it from a place of such authenticity and real lived experience, and it's so powerful and brave. So I just wanted to say that. And also I wanted to ask, you know, you know, I grew up in a family of music, and witnessed a lot of addiction problems, and lost people who I looked up to as uncles and aunties and friends. And I think I blamed the music industry, actually. I think I saw this kind of magic and this beauty, and I blamed the work or the business of it. You know, I won't get too personal now because it's not my space to, but you know, people I loved taking drugs to keep up to finish projects that then never even came to fruition, and they were dropped from massive labels, and they died trying to keep up, like you touched on. It's why I do what I do. I'm trying to rescue people, clearly, you know, because I went through losing people that I couldn't save. When it comes to addiction, I've known many people in addiction. I've had my own dance with addiction, and I still do, you know, it doesn't stop, but it's different. And I think as a counselor, I really struggle when I was training, working with people who have addiction issues, because in my opinion, counseling doesn't work, the program does. And I don't think I actually will say if I think if somebody discloses an assessment, if I get the opportunity before, you know, I won't begin work with somebody who's deeply in addiction, because I don't think that counseling alone can work. I think, and I don't want to hold that. I don't want to become a part of that. I don't want to get caught up in that codependency, the messiness. So I say, I encourage to go to AA, NA, to engage with the steps when somebody's severely sick in addiction. Do you agree? Do you think that I've kind of battled with that a bit, because so you know, one last thing on that, in my training, my tutor, who I greatly respect, said she didn't agree, and that sometimes counseling can be a way into them, the individual going into that. But my feeling, because of my experience, I think I had to have that boundary. Yes. I didn't want to get lost in that with somebody. Also, I think because of my personal stuff. So I'm wondering professionally, what you know, you understand that personal thing too, and what we have to work through within our individual experience to be professional. And so I'm just curious, your opinion. Do you agree? Yeah, there's a lot there. Sorry.
No, there's a lot there. And that's a very important factor of it. But I think first of all, as clinicians, we should decide which cohort we do or do not want to work with.
Yeah.
To what level. So, for instance, I would definitely not have a practice full of non-abstinent or actively using or drinking addicts. That would just, I wouldn't be able to survive it. But I do work with people in active addiction as long as they're able to attend and engage. But I would agree that, you know, people don't really get well or fully well until the drugs and the alcohol put down, or they arrest their illness of addiction. So until the addictive process ceases, then they're in active addiction, and therefore it's very difficult to do the psychotherapeutic work to any real depth or lasting effect. So therefore, my impression and my belief is that you have to arrest the illness. And it's not the only way, but the best way to do that is a 12-step program. It's free, it's plentiful, it's everywhere, it's global, and it's a full system, and it works. Sometimes there needs to be a conduit into 12-step fellowship through treatment and residential treatment, and that can be very important. However, I would say there's a cohort of people who have problematic substance misuse who aren't what we would call addicts, and actually what I would term them as are non-addicts who've become addicted. And for those people, they may not need abstinence, they may not need 12-step fellowships, they may not need treatment. And therefore, what I do with those people, and I can't often tell who's who, but what I do with nearly anybody who comes to me who is in active use of some kind, what I do is I explore them to go on that journey. I support them to do the exploration to discover whether they're an addict or a non-addict who's become addicted. And then they can make the decision as to what kind of treatment is most appropriate for them. And that's a tricky thing to do, and it can be difficult, but I've been doing it a long time now, and I have a kind of method that seems to bring results. And there's been people I've worked with who have been actively using, and I've thought, you're never going to get better. You're so bad, you're so chaotic, there's so much trauma there. I think you're just going to end up using till you die. And then they've surprised me. They've turned up every week, they've talked, they've been willing, they've tried to change, they haven't been able to change, and then I've suggested rehab, and then they've gone, and then they've done it, they've completed, they've graduated, and now the case study I'm talking about, I think, is coming up to 2 years sober and leading an amazing life. So I think it's possible, but I do think that we as clinicians have to look after ourselves. As Cornetta was saying, and we have to make sure that we don't overexpose ourselves to the illness or to the trauma. You know, we have to be very measured in our practice to make sure that there's enough self-care to balance it all out and make sure that we have a career. Rather, what my first manager said to me, you can be the best practitioner in the world and burn out after 2 years, or you can be a good enough practitioner and have a career. Make your choice.
Thank you very much for that. I really appreciate it.
I hope that answers the question.
Yeah, absolutely. Yeah, thank you.
Thanks.